I think the more important question is not the specialty, is the program. Like if it is a university program which is involved in research and scholarly activities, I think you can ask them.
For
Okay.
example, most of the papers on LGBTQ are being published by family med people, and
Oh,
those are the ones that get cited like thousands of times.
okay. Okay. Thank you.
The family medicine will be more focused on the preventive care. Like they'll be having publishing more papers on the preventive care, right? Like the internal
Mm.
medicine will be more on the clinical aspects. But yeah,
Uh-huh.
family branch does some kind of research. Like they do specialize in some kind of research, right? So yeah, if it's a university program, then you can definitely ask about what research opportunities you have that might help me to get into a particular fellowship or something. You can definitely
Okay.
ask some that.
Okay. Thank you.
And that's not a dumb question at all. No question is dumb, right?
Okay. Thank you.
That's a perfect
We're
question.
all learning here. We're all learning.
Yeah.
Okay. Thank you.
It's always better to ask here than like there will be the first chance. Guys, so I wanted to say one more thing about questions to PD and the interviewers. One of the webinars, I saw there was a question, so you can directly ask them not about the program, but about yourself. And it can formulate like, do you have any, like questions towards me that makes me better fit, or do you have some gaps about me? You got the understanding, right? I couldn't formulate now, but the idea was that we can ask directly about ourselves. For example, if they lack some information in our answers that were beforehand that we did not reply to them in a right manner. So to fill the gaps during previous answers, we can also ask the question like, do you want me to talk about one of the topics I have mentioned before? And if there is some gap or they don't feel 100% good, if they will not be lazy, actually, they may, well, some of them can work. They say, oh, yeah, could you tell me about me? Something like that. It was actually in OIT when we were doing some OIT preps, and whenever interlocutor has more time, she or he would go back to one of the points and ask more.
Yeah.
So it's kind of this, but actually we want PDs or that associates to ask us another questions that can even enhance our chance. So this was one of the other question opportunities we can ask.
Yeah. That's a good point. That happened with me during my OET. Right? So yeah.
Yeah, mine too. Like the first one, I did not explain properly what was the disease, and on the second time, I explained so much. The interlocutor was happy. She did not ask it again. Can you explain it more in different words?
So there's one more question that strike my mind right now. Is that we can even ask if something, being a resident working in your program, if something wrong happens on our part in the patient care, then how will you handle that?
Yeah.
You can even ask that question as well. If something happens wrong, like while delivering the patient care, like how you will handle that, how the program will handle that.
I think there was also some insurances the residents had whenever there are some errors. So we can also read about that resident insurance
That is,
as
yeah,
well
that is a
as
malpractice insurance. Yeah, malpractice insurance.
exactly. Yeah, that one. Plus, maybe we can ask about the constructive feedback. I think you're right. It comes to that part as well and how they handle. Yeah.
Yeah, that is.
I was also interested, you have mentioned today about the ethic principle stuff. We were talking about some other ideas. Have you added some? I was interested. Did we want to have some better idea what to say an example? Whenever the ethical principles were compromised.
So yeah,
Ethical principles or compromise, examples, ethical principles.
yeah. When your ethics were compromised, like you felt your ethics were compromised, but you couldn't do anything about that. Any example about that?
we have not came up. I remember we were discussing it, and I was saying about another stuff. So we didn't came with an example, right? We have to ask around. I was just
And
asking
an
the update.
agitated patient of some drug overdose or a phencyclidine abuse patient who had to be constrained, and constraints, physically constrained. Physical constraints are always ethically ethical dilemmas.
Yeah.
Um, isn't
Well, also
like
we
if the
can just
patient
work.
is
Banging
if the patient is
her
being
head
abusive,
against,
like
yeah, no, banging her own head against the wall if let loose,
mhm,
and
mhm. So
harming
I
herself.
don't think it's I think in that situation it's necessary to constrain them. It wouldn't be ethical violation. As we're
Yeah,
taught in steps, I think we have to.
the whole point of making the story is to not tell them
Mhm.
that she was harming herself until the very end. It is supposed to portray that, yeah, those physical constraints was something everybody was raising an eye to. And when the interviewer
Oh,
feels that, oh my God, yes, it's ethically wrong, then you tell them at the end that, yeah, she was or he was hurting herself. You give them an impression that you're answering the question, but you're
mhm.
not really.
Yeah.
So Mariam, like
Yeah.
I remember we discussed this question here on the meeting. So there were like two, three examples that I remember. So somebody told that she was working in an emergency department at a very good private hospital in Mumbai, right, in India. So at that time, she had some patient who had a road traffic accident. He came to his the emergency department. They treated the patient very well, right? They stabilized the patient. Now, because of the financial issues, they couldn't admit the patient. Right, so they had to transfer the patient to a government hospital, which definitely they had to transfer shift the patient to a government hospital, despite knowing the fact that the care of the patient will be compromised, right? But they couldn't do anything in that. Like, it was a financial issue, and they have to like put everything in place. They have to even keep the finance in mind as well, right? The other example that I told during that point is when I was working in the department of nephrology at a corporate hospital. So there was a patient in the emergency, like he had a dialysis today, and next day he came up with a fluid overload, right?
Mm-hmm.
At that time, we were since he had a dialysis day before, and he at the next day with the overload, he needed a dialysis again. But we just tried to counsel the patient. We explained him everything, but he was not able to. He was not ready to get undergo dialysis, right? And we even counseled his family. His family was ready for the dialysis, but the patient was not ready, right? So in that case, like, the autonomy of the patient was, it surpassed my beneficence, or whatever word we have. I just have to find out that word, right? And the patient expired. So that I felt very bad after that. But yeah, I cannot surpass the patient's autonomy. And he was into his senses at that time, right? It was not that he was unconscious, and it was an emergency situation, so I could take over that situation, because he was in his senses. He could answer my questions, he could understand everything, so I couldn't do anything about that, right?
Yeah.
And the similar episode happened, when the patient refused the but though he didn't expire after that. But yeah, it happened, like, so that was my
So
example.
the principle of beneficence superseded the autonomy. Yeah, that's the one thing.
Then
Yes,
the autonomy superseded the beneficence. The autonomy of the
He,
he
patient.
he
yeah.
he declined and you didn't do it, or you
I
did
couldn't.
it.
No, I didn't do. I couldn't do it. Right?
Oh yeah, so they are like beneficence, autonomy superseded the benefit.
So
Yes.
these are two examples that I have in my mind, because these things happen with everybody, right? We don't have
Mhm.
that immediately. We don't have that in my mind, in our minds. But during an internship, or being a medical student, at these things happen with us. So we can just frame an example like that, right? Like, there were
Mm-hmm.
many, like when I was working in that hospital again, like there was a patient with the meningitis at that time, right? So like but he refused the treatment and went away, right? So there are many examples that we can come up with, right? So, like, these
Mhm.
are two examples that I remembered. So yeah, when I frame my answer, I'll keep these examples in my mind.
Mm-hmm.
Yes.
If you have
Exactly.
any other example, please, you can just go ahead. Like, that will be very helpful.
Mm. Well, we had the questions on step 2 about the psycho patients that because they can hurt others. then we don't let them go, and we just hold them at hospital and treat them. This is one of the examples if you had some psychiatric patients, but still it's not very internal medicine relevant example. But you can still, I mean, use it whenever you was in med school. But it was not your decision. So we are not available for decisions. This is one of the examples then. What else?
Yeah, there's one more interesting question. Any interesting, interaction you had with the patient, like which you remember? Like they can even ask us that question. Any interesting interaction with the patient that you ever had? Like if somebody even wants to talk about that, or when your ethics were compromised, you could just go ahead with your examples, because more points we have in our mind and more we'll remember something happened with us as well, and we can frame our answers well, right?
You mean
Can we also
interesting case, right? You meant interesting case, or you said different stuff?
An interesting interaction with the patient you had that you remember.
What do you mean? I'm not getting it. Like interesting case or interesting interaction? You mean
interesting patient, like interesting interaction with the patient that you remember, or even in the
so it's like interesting patient.
Yeah, or even interesting case you had. Like we even have to prepare for that as well, right? Yeah.
Yeah. Today I was thinking about to prepare something with tuberculosis. It was miliary tuberculosis plus abdominal form of it. So the patient was 23 years old with thrombocytopenic purpura, idiopathic, even polyarthritis, and it was very, very hard because it was on steroids, and steroids were further suppressing the immune system and activating tuberculosis, and it was dilemma to treat at the same time tube and this autoimmune disease. So something dilemmatic, I think, would be the case.
I have to come up with an interesting case as well. I didn't think about that. So the interesting interaction that I remember with the patient, just let me know if I can speak that during the interview. Like once after my internship, once I was graduate, I was working in a hospital internal medicine department. So I will stay in Jammu, and there was one patient from Kashmir. She had a fight with her husband, and then she ran away and came to my city, right? And she was, admitted, but she was brought to the emergency department by the police, and we had to admit her to a medicine ward, right? And then we just over few weeks, like we used to have interaction every day with her, and then she used to request me that she wanted to meet her family, right? She wanted to go back to her home, but she didn't know. She was illiterate basically, so she didn't know she didn't know the number, neither the address of her home. Like then I just searched she knew the name of her husband and a few people in that area, so I searched that on the Facebook, right? And through that we just try to reconcile her with her family, right? So I think that was like though it's not related to anything to medicine, but yeah, that was a very interesting thing that happened with me.
I have a case too.
You can use that. I think you can use that.
That was like interesting patient, but that was not an interesting case.
Yes.
I have to come up with an interesting case, but that was my interesting interaction.
Yes. This is an interesting question, yeah, but not medically related, as you said. But like it's an interesting one.
Yeah. So, and we are discussing interaction, right? This is a new question, completely new question for me.
Okay.
This one time we had a patient of myasthenia gravis. He was being taken up for an appendicectomy operation, and we needed to assess whether or not he would require a post-operative ICU care, and whether or not he will have a worsening of the myasthenia respiratory comorbidity. So we went to the bedside, the whole neurology team, and we asked him to do the single count breath test, in which he had to say 1, 2, 3, 4, 5, 6, 7, 8 up to as much number as he could. But he did not understand, or I don't know if he spoke the same language, but the question did not go through, and somehow we could not interpret the test result or his count. So I suggested that I don't know what came on my mind, but I suggested that he should say a Hindu prayer.
Nice.
Right. Yes. So the patient looked up at me and he smirked. And I'm standing, and the whole team is standing, and they are also agreeing. Yeah, he can, if that is what he's able to do fast. If he's able to speak the prayer fast, we will give him a green flag about he doesn't have a respiratory comorbidity. So, but the patient is we are asking the patient to say the prayer, and the patient is looking at me and smirking. The wife is looking at me and smirking, and I don't know what came over me. I opened the file, I read the name. It was a Muslim name. And then the patient goes, Dr. Priyal, I will learn the Hindu prayer and I'll let you know. So sweet. I was mortified. Gave him a clean, yeah, you're good to go. How is this for an interesting conversation?
That was
Mm.
interesting.
That was indeed, yeah, that was a good interesting case. Yeah. So like we have 69 people with us. Like everybody can freely, you can switch on your mics and speak. Like, so first we discussed about the questions. Like initially we start, as many people joined late. So we started with like what questions we can ask the residents or the program director. So like we just came to a conclusion that the questions that we're going to ask the program director should be very formal. And like the questions we're going to ask the residents should be like little less formal, right? Not very casual also, but yeah, little less than formal, right? Then the other point we were talking about, any instance when your ethics were compromised, right? During your practice, like they can ask you this question. That's a behavioral question. Then the third question we were asking about any interesting case you have, or any interesting interaction with the patient you ever had, because they can ask us this question, and we need to have one or two instances in our mind, like we need to talk about that during the interview, right? So that's what we have been discussing so far. If you have anything to add about anything, please go ahead. Or yeah.
I basically had one interaction. I don't think it's that memorable, but basically I was way early in my intern year, and I was in the medicine department rotating the pair. There was a young girl who came with tuberculosis, and we started her on treatment, but she underwent an anaphylactic shock because of the antibiotics that were given, and which was unforeseen. Basically, we don't test for the anti-tuberculous antibiotics that whether she's sensitive to it or not. So I remember that the whole night I was just sitting beside her because her mother was so worried, and like just dispelling her, checking her vitals like every half an hour, then every hour, then every 2 hours. And like they were really grateful of me that I did that in the end. But like it was my responsibility. I don't think it's that memorable. It's just that I remember it because it happened so way earlier in my intern year.
Yeah, that would be.
Yeah, even you can tell that during the interview. Like, see,
Mm.
every interaction is unique, right? Everybody doesn't have to have a particular interesting case or particular interaction to
Yes.
like have say. So you can just definitely bring that during the interview, right?
Mm.
I think what they are analyzing in that question is which case you pick. I mean, in every case you pick, it depicts your kind of skill or humanity or any level. For example, in that case, you showed like really super empathy, right? It should not be awesome case. They have seen a lot, but it shows characteristic about yourself. So whenever you pick, just pick a case, just see how you look and what was your role and what characteristics show and what can you tell about
Yes.
yourself. So this is because you reflect yourself in a good way. That's it.
Yes, you're perfectly right. They're looking for some kind of characteristic associated with that. So maybe it's a real case, but we have to frame it in a way that it shows that we did our part, some form of characteristic of ourselves. It highlights that.
Basically, they just want to know whether we work during like whether we were interested in doing work, like whatever we have written in our CV, whether we have done that or not in reality, right? They just want to figure that out,
Yes,
right?
basically. So they can ask follow-up questions and we have to be prepared. Obviously, they will ask basic follow-up questions, but we don't have to be blank there. We have to answer them.
Yeah. So like even I had one more interesting case. Should I go ahead or somebody else wants to add something? This meeting
So
is not
I
about
I think you can
moving.
go. Yes.
so hi everyone. I don't know if this is interesting, but I think I have an interesting patient interaction. It was way earlier in during my intern year as well. Uh, I did it in a government district hospital, so we don't have much residents there. So most of the inpatient duties are handled by the junior physicians or medical officers who are there in the department. So I remember there was this homeless guy who had diabetes, and he had a wound with lots of maggots infestation, and we had to remove the maggots and clean the wound. But since he was isolated in a separate dark room, I don't know why it was very dark, and obviously there was no residents, and the nurses were reluctant to remove the maggots and clean the wound and stuff. So he was there in the room for like a few days, and his obviously his diabetes were under control, but his wounds were not getting healed. So as an intern at that time, I took it upon myself. I went into the room. I saw him, and it was really smelly. I mean, it was very hard to sit in the room with him. Now I felt really bad for him as a patient, sitting, and he has to deal with that smell too. So I felt really bad for him, and I took it upon myself, and I still remember, it took me almost like 2 to 3 hours to remove the maggots by myself, and I cleaned it, and I cleaned the wound, and I started to heal. So I and then I started going to see him every day after my hours, and then I cleaned it. So it started the healing well, and he also started feeling better. So that kind of gave me a very good feeling of him improving, and eventually leading up to discharge. So that was an interesting case for me, which solidified my interest in medicine. So I don't know if this is interesting, but it was one interaction that has stayed with me for a long time. Yeah.
Oh, nice. It talks really good about you. And as you have mentioned from the beginning that it happened very, very in the beginning of your journey, you should say that sentence like it may not sound as interesting, but it was for me like the first experience that I did on my own or something like that.
Okay.
That was
Yeah.
that was a more than interesting, to be very honest. That was a very good, interesting.
Yeah.
Yes.
Like something you feel is special, right? It
Yeah.
might be special for you, so you don't have to feel that it's less interesting or something. Like even I had some interesting case that might be interesting for me, not for you, or
Yeah.
right, or that might be less interesting for me, but more interesting for you, right? So that shows that we have empathy towards our patient. That shows one of the qualities that we have empathy towards the patient, right? One
Yeah.
like
Yeah.
me finding reconciling that lady with the family is not interesting. It's not. It has nothing related to the medicine, right? But still, it shows one quality of mind, that is the empathy towards the patient,
Yeah. Yeah.
right? So it's a very
Maybe
interesting.
you can add on some spices on that. I mean, you can just put that due to the limited resources. As we know, the back home country we have limited resources in the hospital and they're not that clean. So you can just add on like because patient was sitting alone in that room and it was too smelly. So on your own expenses, you try to purchase any air freshener so that the patient feels fresh in that room and he does not have to go through that smell. So you can just make up some story like that. So you care for the patient, not only in healing, but you care for his health as well. That's why you
Comfort.
brought some air fresheners and some fresh flowers in the room so he feels better.
Yeah.
Maybe
Yeah.
it can make your
Yeah.
story look much better.
Yeah, I know. I think I have to rephrase it so that it sounds a little more interesting. But this was something, and also I still remember, I made some arrangements so that he could take a bath. Even, it was really hard for him to take a bath with all this wound and maggots and everything. So, I had to get the male attenders to, come in and help. Obviously I couldn't do it because it was a male patient, but I had to get in the male attenders and do the stuff. So yeah, I agree with you. I have to rephrase my answer so it sounds a little more interesting. Yeah.
Mhm.
Thank you, guys.
And don't lose that part during rephrasing that it was like dark room and no one actually cared for him, but just you, and you made your decision, like you did your autonomy stuff, right? You
Yeah.
didn't ask anybody and you did the best thing for that. But in
Yes. Yeah. Thank you, guys.
Yeah. Anybody else has any interesting case interaction you want to talk about? Like that's very interesting, listening to everybody's interesting incidents. So I can just go ahead with mine if somebody doesn't want to speak, right? So I was at St. Peter's in the month of June. I was doing my observership there. So there was one patient with the end stage renal colon cancer, right? He was completely bedridden, like he was very like he was very thin, and he was like he couldn't do anything, right? He was completely bedridden. So he had his mother along with him. So and she used to take all the decisions. Like she was a very dominant lady, right? So like everybody used to talk that she used to take every all the decisions at the home as well, and about his health as well, right? But he was in a lot of pain, and so he needed some medicines to get relief from that pain. But her mother never used to allow the doctors to give him any medicines, right? So like he was in a lot of pain. So what the residents and the attending used to do, like whenever her mother was not there, they used to go and interact with the patient, and try to hear him, like what he wants, right? Because at the end of the day, since he was in his senses, so we had to give importance to his autonomy, right? So then he told that he wants some pain medication and everything, right? But her mother never used to let any nurse give him the medications, right? Then after sometimes, like even there was an incident when they had to call the security to get her mother out of the room so that they can treat that patient well, right? Then after a lot of efforts and counseling the mother, then they finally they came up to a conclusion that now he'll be discharged on a hospice care, right? And that was an interesting case for me, right? So it was a case where I could actually see how the autonomy of the patient was given a lot of importance, right? Over the decision of his mother. Yeah.
The question here is, did the patient's pain really go away? How did you treat the pain? How did the residents end up treating the pain?
Yeah, it was like once he was actually relieved of pain, like he had some relief of pain, definitely.
What did he receive
Like
in end stage renal disease?
no, he was having end stage colon
Colon
cancer.
cancer.
Colon
Okay.
cancer.
The basic even opioids will relieve that pain, right?
Right.
Yeah, so they just gave that, he was relieved, but his mother never allowed to give him any medicines. Like he never, she used to even control what he's going to eat, and she was very controlling and dominant, right? So there were instances when they had to call the security to get her removed from that room because they had to treat the patient. But then finally, they got the social worker involved, the senior doctors as well. They came and counseled the mother and explained her everything, right? That the patient has himself told that he wants to get the treatment and get relieved of the pain, and they have to give him, so the autonomy of the patient is the foremost thing for them, right? Then she agreed for the hospice care and everything. But then finally, he was getting care after that. Yeah.
So, what was the reason that the mother was doing like this? Was it out of ignorance or was it something else?
So we don't know the reason, but what the medical students and the residents they used to discuss in the room was that was her protective mechanism. That was her defense mechanism, that she couldn't accept that his son was having very bad health, right? She couldn't accept that he was going to die in some time because his condition was very bad. He was having end stage colon cancer. That that the medical students used to discuss with the residents in that room. Yeah, that's what I heard. Yeah. So, Indu, do you have any interesting case or interesting interaction?
I had one interesting interactions with
Go
this
ahead.
patient. It's not a interesting case. I prepared another case. If the interviewer asks, like, tell me about a difficult conversation or difficult patient you handled at work, probably I would say that cases. So I would answer like that. During my recent clinical rotations at Hamtramck Cardiovascular Center, one of the patient asked to me, "You are a foreigner. Why you are here? We already have doctor from the USA, and so are you doing?" So initially, when he said that, and I felt a little bit a different kind of question. It's not related with my medical knowledge. The question was a little bit different for me. Then I thought, how can I address that patient question and concern? Then I acknowledged that patient question, and I said them, how long does it take to get the appointment to this renowned cardiologist? And he said it took me 1 month. So I said, oh, it's a long time, right? So if there are more cardiologists, you could see the doctor earlier, right? And he acknowledged, yes, you are right. And you see, so there are lots of foreign trained doctors coming here. We all are working to improve the US healthcare system, utilizing our knowledge. And it's a win-win situations. We contribute here, and as well as here the US healthcare systems get help from us. And we all are trying to improve the US healthcare system. And he understood that, and he said, yes, good luck to you, good luck to your residency. And on that situation, I found sometimes not only utilizing our medical knowledge, sometimes if we do good communication with our patient and build a rapport, we can address their issues too, which is not related to the health or disease. I found that communication and the difficulties sometimes we face, and we can solve it utilizing showing our empathy and doing an effective communication.
That's a good example.
Very nice. Yeah, that's a good
Well
interaction.
prepared.
Yeah. So anybody else wants to add something?
Yeah.
Yeah, go ahead, Harshita.
Yeah, so during one of my on-calls in the emergency department during my internship, like I was assigned to see this patient, this male patient who had thyrotoxicosis. So he was traveling back to his home country, but he was sent back by uh, the airport authorities because they thought that he was not fit to travel because he had exophthalmos. So they thought, okay, like, maybe get a fitness letter from the doctors, from or the hospital, and then, we can like let you fly. So they brought him to the hospital. And so while I was examining him, of course, like I felt that, he was not fit for travel because he had tachycardia, tremors, he was very agitated, and so I called up the internal medicine attending, and even he agreed that he should be hospitalized because if you leave this patient untreated, the chances of him uh, like dying and without treatment, he would still be denied the permission to travel back to his home country. So I tried to explain to him, like, it's for your own good that we're planning to admit you. But he was very hesitant at first, because he had lost his job. He did not have any health insurance, so he did not want. He's just like, just give me a fitness letter for me to travel so that I can go back. I don't have any money. But then, of course, it's illegal to just make up a fitness letter like that and then give it to him without treatment. So I had to call the social worker, and then there was a charity organization which, helps people who have lost their jobs or don't have any health insurance, to at least get the treatment costs settled. So I had to like coordinate between them, and then we were able to convince him to get admitted, get treated. And yeah, after like he was there in the hospital for a few days, got treatment. We gave the attending gave him a fitness letter, and yeah, he was fit to travel back to his home country.
Yeah, that's a very good. Yeah, that's a very good, interesting case you have. Yeah, that's a very good. Like it shows that how involved you are with your patients, right? Like it shows even the component of empathy, and how you went out of the way. You pulled in the social worker, and you just got his cost settled as well. So that's a very good, interesting case. Yeah. So, Anybody else wants to talk about something, like any other question you have, that's fine. Like we are almost done with all the questions. So anything you want to ask, like anything you want to discuss right now?
I think difficult patient, like Dr. Rajani was discussing. I think we should discuss now a difficult patient or a difficult case or a difficult colleague.
Yeah, difficult colleague is even a very good point. So yeah.
Like, what would be the answer if you are in a conflict with your colleague and you tried your best to solve that conflict, and even though it's not resolving, what you could do?
So yeah, like we can just go ahead just a second, because Yash just raised his hand. Yash, just go ahead like with your, then we'll discuss, come to this question. I'm so sorry, like we just have to, like, Yash, do you have something to speak? Yeah, go
Are you
ahead.
able to hear me?
Yeah, very well.
Yeah, okay. Yeah, so I had an interesting case. I was in the gastro department in University of Miami, and there was this one patient who was scheduled for a colonoscopy the next day, and I was given the task of telling the patient to drink all of his prep, colonoscopy prep, the PEG-LEC, I think, and he was supposed to come have like almost, I don't know, like a lot of glasses of that prep so that he could be prepped for the colonoscopy on the next day. And I went to the patient and I told him to take it, and he was like, it tastes really bad. Like I can't drink it. And the funny thing about the whole situation was, I would be like, but you need to have the whole prep, or you need to drink the whole prep, or else we won't be able to, take you for the procedure. And he's like, no, I'm not gonna drink the prep. Probably I'll have a little bit and then I will stop. And then I would go like, do you want to have the procedure? And he's like, yes, I want to have the procedure. And I'm like, but are you gonna drink the prep? And he's like, no, but I won't drink the prep. So it's like we went back and forth again and again. And then after a while, I just gave up on it. So I think it kind of like I mean, we've had this thing wherein patients kind of deny taking certain treatments and things, but this was one of those cases wherein, I mean, he kind of knew that he needed to have the colonoscopy to get it checked and to get the whole thing done. And if there is some issue with him down there, you could find it out. But he just wouldn't take it because of the taste, and it kind of taught me, and no matter, and I was like putting my best there, trying to get him to do it, but he just wouldn't take it. And that was like one of those situations where I felt, no matter how much effort you might put behind a patient, it is very much possible that ultimately at a certain point you just give up. That, okay, if the patient just doesn't want to, and I mean, I obviously kept on telling him again and again that, it's your decision at the end of the day. So I think it was a good experience for me to handle the patient who was not very compliant. So like as far as compliance goes, I think that was a good case for me. Yeah.
Um, it's a funny story,
Mm-hmm.
but so you explained to him that if you don't drink the PEG prep, the colonoscopy might not be as accurate as it would be if he drank it.
Yeah, it was just not me. Even I think the chief president, I think the PGY6 was with me as well after a while, and he tried. So I think what you're trying to get at is that I might come off as someone who probably didn't put his best efforts there as far as convincing him is concerned. Are you getting at that, Priyal?
Yes, that's what I'm trying to get at. I don't want.
Yeah. So basically, the PGY6 was with me. So we can't really say that I didn't give it my best, because he tried to explain the same thing, and I kind of was learning under him. So I gave it my best shot. But the point I'm trying to make here is that at a certain point, like it's a learning point, right? Like it's a learning game for us. Like you're trying to understand how compliance works. Like if you're educating a patient about something, how much of that education is actually going through? Is the patient understanding everything? Does the patient understand and still doesn't want to go ahead with it? So in a way, that was like a learning point that, you might like, in a way, I did feel defeated. So if you're gonna tell me that, probably bringing it up in an interview, I might still consider whether to actually say this case or not. So I'm definitely gonna take your feedback whether
What did you do? What did you take home? What was your take home? So you
but I
take
think
home that the patient was genuinely in trouble. That's why he wouldn't drink. That's why he put his own procedure at stake, despite knowing that the procedure might be affected. So you went back home with a question that how you could help this patient. So there is something called as mucain gel, which alters or anesthetizes the tongue and impairs taste sensation, and it's just a local anesthesia. So if you probably numb the taste sensation of the tongue, he might not be able to taste the bad taste of the prep. And then you
so
went
it was.
to your home with this question. You found the answer of possible medicines you could have given, possible medications you could have given to this patient before giving the prep, and you went back to the hospital and discussed with your GI team. You could say that.
Yeah, I could have. Yeah, I could say that. That's a good feedback right there. But the thing is, it was not just the taste. He had a lot of issues right there. So it was more of along the lines of that he was worried that he's losing weight. So if we give him a laxative, he's gonna lose so much weight, he's gonna disappear. Those were his actual words. I'm gonna disappear tonight. So, it's like, so yes, you're right. So I'm gonna take your feedback, and probably if I had to say this during the interview, probably I would put it the way you asked me to, probably rephrase it and probably put it that way. But so it's like at the end of the day, I still feel that even though the resident tried and probably gave him a lot of options, he just didn't want to. So, but yeah, you're right. Probably if I want to end it on a note wherein what did I learn and what could I possibly do with a patient like that, and when I want to explain it to a program director, probably yes, I would come up with a definitive plan that this is what I did. So yeah, that's good. That's good feedback right there. Thank you.
Yeah, just the same thing happened with me when I was in at St. Mary's in Decatur. I even used to observe these colonoscopies and endoscopies. So the problem right now at that time is that patient, they have to fast for maybe 24 hours or half day before this, and after that they have to drink this heavy solution. So patients are very hesitant in doing that, and it's required for the colon preparation, right? Even after many times they don't have a well prepared colon. Yeah, but you can definitely say that I tried my best to counsel the patient, explain him the importance of the procedure and how drinking the solution will help him. But at the end of the day, autonomy of the patient supersedes me giving the best treatment to the patient, right? You can just frame it that way. Otherwise, it's an interesting case, right? Like
right. Yeah.
Like that's what Priyal told, that you have to just show that how you did your best in that.
Right. Yeah. Right. Yeah.
We counseled, we tried the best, but yeah, it was like his autonomy, superseded, so we couldn't do anything at the end of the day. Yeah.
Right. Yeah, I understand. Thank you. Thank you for the feedback. Thank you.
Yeah, I agree with what everybody has been saying. But another thing, whatever story we are giving out there, we have to say it in a way that would favor us and make us look good as in all before them, because we can be faced with such a patient during residency. Are we going to leave the patient like that without doing anything? So whatever we are saying, it has to be in our favor. That is exactly the type of things we'll do when we are doing our residency. You get what I'm saying? If I was the one to answer that question the way you've said it, I won't say that part that he refused, or at the end of the day, you'd say it. I would say it in a way that it will favor me. That okay, maybe after a lot of persuasion and all that, I gave the patient several instances of similar, maybe patients with similar condition, that at the end of the day, when the patient had that thing, the result of the whole thing came out to be positive, things like that, just to convince the patient more. Then at the end of the day, the patient agreed, which was, it will make you look as in, it will make everything sound even better that way if you present it. Even if at the end of the day, in real life, it didn't end that way, but you can make it sound that way. You get what I'm saying? Just to like make it look good to whoever is listening to us. They don't want to hear how we were not able to achieve that thing. So let us make it, create it in a way that it would be positive at the end of the day. You get what I'm saying?
Right. Yeah, that makes sense. Yeah.
Like my attending used to say the patient that if your colon is not prepared, then you might have to undergo the colonoscopy again, right? So you have to undergo the anesthesia and everything again. So it's for your benefit that you have a good colon preparation. That's what my attending used to say to the patient. Yeah, but that's a very good point that the doctor mentioned, that you have to just show a positive ending. So you can just rephrase the incident like, after persuading him a lot, then after that he underwent a colonoscopy, and that you can just phrase it the way it looks good during the interview. Yeah, that's a very good point.
Right.
So, Dr. Rotuna, like you were saying something. I'm so sorry to interrupt you at that time. Yeah, you please go ahead with your point now regarding the difficult patient. I think she's not here. So anybody wants to add anything? Like, do you have any other questions you want to discuss right now? Because we are still 11 minutes to, like, we'll be 1.5 hours into the meeting, and I think that we'll close after that. We can just, meet tomorrow as well. So yeah, if anything wants to add anything. So we had a lot of interesting cases. If anybody even had a difficult patient, you can just mention about that as well. Like, you can just talk about your incident.
Hey, yeah, today we had a very good discussion about all the ethical question as well as the difficult patient interaction questions, and everybody gave a very good feedback. So as Ayushman said, we are just left with the last 10 minutes. I'm just want to brush up on a very simple question, but it is the most asked one. Like, if somebody asks you, like, why internal medicine, how will you frame that?
So yeah. So sort of just, before we move on to this, that's a very important question. Yeah, I just have few points in my mind, but I just moving on to this question. So I just want to say, like, tomorrow onwards, like, I think we should just prepare our draft and discuss the answer here. Not discuss, we should just, tell the answers, like whatever we have drafted, and we can just follow by, maybe 30-second, everybody can just give the, give their points on that answer now, because I think we're done with the discussion. We have covered almost all the questions. Like, I think we used to cover 3 questions every day. So we have covered till now, maybe 15, 16, all the questions, right? Even we covered today the ethics question as well. So from tomorrow onwards, even if you have to start with, tell me about yourself, because I haven't drafted any question answer right now. I have a lot of points in my mind, but I haven't drafted anything, So maybe, like, we can just start with 3 questions tomorrow, because 1.5 hours is a long time. Right? Even, even if you have 50 people joining the class, everybody is not going to speak here, right? So even, if 5 people, answer that particular question, still we'll have a perspective of 5 people, and we can just learn from that, right? So, like, from tomorrow onwards, we can just draft and go with the answer instead of, discussion. And we'll just start with the basic 3 questions. Like, we can just discuss that at the end of the meeting. Like, first one will be, tell me about yourself. Right? So tell me about yourself. Like, should be we'll just draft like what we want to say during the interview, right? Because it's a free interview prep we are doing at the end of the day, right? And everybody giving their points a lot. We are learning a lot from that, right? So, like, we can now, instead of doing discussions, we can just go with the proper drafted answers, and we can just have a session tomorrow onwards. We can just just speak out during the interview preparation, right? So, like, first question, like, would be, tell me about yourself. Then second question will be, why I wanted to be a doctor, right? And third is, why US healthcare system. I just I just post these questions in the group, and tomorrow just be prepared with these 3. Instead of doing any discussion, just go ahead with the answer. Like, it's fine even if that's wrong. Like, I think my answers would be wrong. Right? So we all of us are here to learn. So, like, tomorrow, like, I'll just post the 3 questions. Tell me about yourself, why US healthcare system, and why I wanted to be doctor. And we'll go with the answers instead of doing a discussion here, right? Maybe we'll be able to finish these 3 questions in 60 minutes. and we can just learn from every answer we get, because we have to we need to learn answers at the end of the day, and they should look like spontaneous. So we can just have points in our mind, like somebody asks me what are my strengths, like they can ask me just name your 7 strengths. It depends, right? They can ask me anything at the end of the day. Maybe they can ask me 3 strengths, they can ask me 5 strengths, or they can ask me 7 strengths. If they ask me 7 strengths, I need to have those points in my mind, and then I can just speak about that, right? Instead of having a pause during the interview and thinking about that, I should just have those points in my mind. So from tomorrow onwards, we'll just do the answers instead of any discussion, right? I think,
I have a
like,
suggestion.
yeah, you can just go ahead, like if you're fine with that, or you have anything else to tell, then we'll move on to why internal medicine.
Yeah, Ayushman, I have a suggestion. So,
Yeah.
like let's say if we're meeting tomorrow for 1.5 hours, we can keep like probably the last 15 minutes for someone to like ask questions. I mean, sorry, discuss the questions which we haven't, you know, asked before, discussed before. So we can do that so that at least if anyone comes up with new questions, we can,
Like,
like
because
talk
yeah,
about.
that's a very good point, because if some, I think at the end of the day only 8 to 9 people are going to speak, right? Others will only hear, right? That's fine. Like, everybody's not comfortable speaking in front of maybe 50 people or 40 people. That's fine, that's your personal choice, nobody's going to judge you over that. But yeah, even if we talk about 3 questions, I think we'll be able to do that in 10 minutes, in 60 minutes we'll be able to finish that. And after that we can just discuss, or whatever anybody has a doubt, we can talk about that, right? But
Yeah,
this
that is a good idea.
but this way we'll be able to draft at least 3 questions per day, and by maybe in 5 to 10 days we'll be able to cover around 15 to 20 questions at the end of the day. Because at the end of the day we need a preparation, right? Instead of discussing things, we can just shift to just answer mode, and we can just correct each other, right? Because I think the criticism is the best way to learn, right? So I'm done. Yeah, please go
So
Um,
I have one. I was drafting one of the question answers, and I have confusion. So we can discuss about each other question confusion after discussing 1 hour, right? For 15 or
ahead.
20
Sure,
minutes.
yeah, yeah, yeah. Even if
We
maybe if
don't
I
know
done in
the
60
answer.
minutes, we
Yeah.
can go ahead with that, of course.
Yeah. So for example, I was drafting an answer, like if you had a conflict with the someone, how did you solve this? So initial response would be, first I tried to solve it by myself. I talked with the co-residents, and we went to the cafeteria, or discuss about that particular topic, something XYZ, and so was the problem, try to solve it by ourselves. And then we took the help from the senior residents, and as well as from the seniors, to solve that conflict. Even though if it's not solving that conflict, what can we do? Is there anything, I mean, how would be the answer sequence for that, for any situation? Do you have anything in your mind?
Okay. Yeah, anybody wants to talk about that? Then sort of I'll just let you know what we discussed about why internal medicine. Like, we had the similar question yesterday, so like whatever points I had, I'll just mention like whatever we discussed yesterday, so you can just take the help from that in framing your answer. So like, first, right now, anybody has an answer to this as well? Like, how will you and like you know handle difficult situation?
Conflict between
Yeah.
residents. Mhm.
The thing that I understand is that you were exactly right in that first we have to talk the person that we have the conflict with. Then we
Mhm.
introduce a mediator. The mediator could be senior resident, chief resident, whoever. But the important
Mhm.
point you have to communicate in the end is that you're open to criticism, you're open to suggestions, you put forth your point, you listen to others, and you internalize it, and then you come to a conclusion at the end. Because if they ask you this question, you have to mention, obviously, I don't think they will give you a scenario. If they give you a scenario, then you have to frame your answer according to the scenario. But usually at the end, you always have to conclude like that. That means if I'm open to suggestions, I'm not like negative towards criticism. If something I'm doing wrong, I will learn from it, I will improve myself, and it won't happen in the future.
Yeah, that makes sense. After imputing everything that was discussed now, as in, then you try to like whatever the point the person made, that maybe you're doing things to the person, so you try to adjust. And if after adjusting the person is still behaving somehow to you, then you can now report to the higher authority. You can report to a supervisor or program director or something. After incorporating those things you've already discussed, and there's still no changes, so you can report them.
Oh, thank you.
Yeah, so for me, if I have a difficult situation ever in my life, first thing that I do is I analyze that situation and I'll analyze what went wrong in that situation, right? Maybe it's my fault. And if it's my fault, then I'll try to improve on that. But if it's, I just feel it's a fault of the other person, then I'll have a, I'll confront that person and, try to, and in 90% of the cases that will get resolved when once I confront that person, talk to him, very calmly, I'll talk to that person and try to get it resolved. And I think 90% of the time that will get resolved. But if it doesn't get resolved, then I'll take a help of a mediator, maybe somebody senior to me. I ask for the help, and after that, like if it doesn't get resolved, even after that, then maybe I'll approach a senior figure, like maybe one who heads that particular program. Yeah.
Got it. Mm-hmm.
Like that's for me. Like I don't know, like. Yeah. So yeah, Dr. Saurav just asked about why internal medicine. So yesterday we discussed this point, right? Why internal medicine? So firstly, we can just say like what everybody discussed was that like maybe we liked it more during the like doing the clerkships during the 3rd and the 4th year of medical school, and even during the internship we liked internal medicine more than the other branches, right? So we could have the second point is that we can just say that like even somebody told yesterday that we like maintaining a long-term relationship with our patients, right? And that is what the internal medicine offers you. Thirdly is that's my post that I mentioned was that in US the primary care physician is the first contact with the patient, right? And after that for seeing the condition we can just make the referral to the required specialty, right? And the fourth is like somebody told, even a good point, that we get a raw patient, we do all the diagnostic tests, and then we come to a conclusion. That is what I like about this branch. Yeah, that were 4 points sort of that we discussed yesterday. If you have anything interesting or anybody has anything interesting to come up with, please go ahead.
Yeah, I think all those points mentioned earlier is very, very valid. Then maybe one additional thing I want to add is the opportunity, I think the career opportunity or flexibility. That you can decide maybe after residency to be an hospitalist, you can decide to be a primary care physician, or you want to go into academics, or maybe things like that. It's flexible. You can decide to go into whichever specialty you want.
So I have a point with respect to this internal medicine. I agree with all the points what Ayushman and the doctor has mentioned. All those points are very valid. But I also think it would be really good if you can add a personal touch to the answers, because that kind of has a better impact. So for me, this is what I was trying to say. I still have to rephrase it. So obviously, like Ayushman said, it is the first internal medicine is like the frontline care providers, where they initially triage the patient and then send the patients to different specialists depending on their needs. So for me, in my case, I felt like my father was diagnosed with glioblastoma very late in his stage, after going through repeated treatments with as a migraine for migraine. So initially it led to vomiting, and then MRI, and then glioblastoma. So I kind of this lingering question of early diagnosis, misdiagnosis, kind of lingered in my adulthood and childhood. So that kind of gave me an understanding that being in internal medicine is and have a strong internal medicine skills is very necessary to accurately diagnose a patient and triage the patient accordingly. So this is one of the personal. So I think all the points are very valid, but if you can add some personal touch to these answers, I think that kind of enhance the answer. That's what I think. Okay, that's it.
Yes. Like when I was working, looking after dialysis patients, just seeing them every 2 or 3 days a week, I used to interact with them. I used to talk to them. I used to counsel them many a times. Like I used to even tell them not to drink too much water. Like when I used to see that their fluid is, increased compared to the last dialysis they had, then I used to counsel them, and they used to feel very happy about it. And then they used to do that. I used to counsel them every time. Even a smile I gave to them, they used to feel very happy about that, right? So I just loved, I like those things as well, and it's a part of internal medicine only. Anything else anybody wants to add?
For example, I would not say I would like to make a long-term relation with the patients because I want to be a hospitalist. In that case, I make my answer like that. I love to see patients with the complex clinical signs symptoms, and I want to serve the people during their most vulnerable conditions when they are admitted to the hospitals. And as a hospitalist, I would love to enjoy communicate with the people in different subspecialty to make a good care for my patients, and that's how I can serve to my patients. So that's why I work in internal medicine, and I would love to work it as my profession.
Perfect. That's perfect. It's very nice. Like you give another perspective as a hospitalist. So yeah. So anybody else wants to add something, or we should?
Yeah.
Because, and tomorrow onwards, I'll just post the 3 questions. Tell me about yourself, why US healthcare system. And the third question is why you wanted to become a doctor. And we'll just go with the answers during the first 1 hour instead of, discussing things, because we have discussed a lot of things and there's a lot of information available outside on the internet. So we'll just, begin the real practice from tomorrow, so that at least by 20th, we are done with all the questions, and we can just try, we can even do mock interviews after that as well, right? Because most of us will get hopefully most of us will start getting the interviews for the late October, or like some people might be getting it after 15th October as well, right? So we can just start, working on our answers, and yeah. So I think it's like we should just end the meeting for the day and let's meet tomorrow. I'll just post the questions, and yeah, we can just begin with the real practice from tomorrow onwards. Yeah. Yeah, thank you so much, everyone. Like we had a wonderful session today. So yeah, let's meet tomorrow at right around 9. And it's just a request. Like somebody even told me that whenever you use this online platform, just have your name written below it instead of some nickname or something, because it doesn't look nice. Right. So even I had written something else. I changed it to my name. So yeah, if you can just change your name to that, and even if you can add AAMC ID to that as well, that would be like good for you only. Like that's what somebody told me, like during one of the sessions I had, that you can just write down your name or AAMC ID, beside that name, so it looks nice, because it's easier for the other person to address you, right? Like somebody's having a name by maybe iPhone or something, like it's difficult for us to address. Or maybe somebody's on the other side, maybe a program director attending, it'll be difficult for him to address you. So yeah, you can just change your names to your actual name, right? Okay, see you tomorrow at 9, and we'll just go with the answers. Thank you so much, everybody, for joining, and have a good day.
Bye, everybody.
Night ahead. Bye-bye.
Bye-bye.